Hi friends, this is my short video on quality improvement using the PDSA process, and I wanted to talk about mainly that quadruple aim that the material we talked about, or the material we went through this week discussed. So the triple aim was in enhancing patient experience, improving patient health, and reducing costs. The quadruple aim was improving the experience of actually providing the care. And a lot of the articles I read this week were talking about how that is something that we are concerned about right now with nursing. And so the aim that I wanted to work on was increasing nursing satisfaction and retention rates in an acute care setting or in hospitals. The team that I would need for that is obviously staff nurses, unit manager, and CNO, or someone else from administration. The way we would measure that with establishing the measures would be quarterly satisfaction surveys and semi-annual meetings. So I have seen, we will have a survey, and then we'll have an HR meeting because the responses are bad, and then it's kind of the end of it. So this would provide a continuous measuring and monitoring of, hey, how's our staff doing? And then the changes that I would select and obviously coordinate with this team would be increased communication, increased support staff, and improve EHR efficiency. So increasing communication with namely with patients about HCAHPS scores, which may sound like a little bit of another issue, but HCAHPS scores directly affect our hospital's reimbursement, and in turn their budget, and in turn our pay and benefits as nurses, which does affect nursing retention. And then increased support staff. So just having the standard to be a free charge nurse and a good or satisfactory number of techs and other support staff. I've seen that has been huge when I have seen nurses leave. It is typically because they are cutting our staff down. And then improved EHR efficiency. So I think this kind of goes hand in hand with patient satisfaction, which affects HCAHPS scores, and then also our satisfaction with providing our care. So I think we need the EHR, we need documentation, we need charting, but if there's a way to streamline it more to where it was not consuming so much of our time and distracting us so much from our patients, that would increase nursing retention. And then to test the change, this is the doing part of the PDSA cycle. So we would, implement each of the changes, increase the communication, and go through each of those, and then test them through financial reports mainly, to say, hey, yes, we've invested in our nurses and our staff and in this area, but has it balanced itself out with what is our return on investment? Are we retaining more nurses? Are the surveys improving? Are nurses staying longer, etc., etc.? And then implement and spread. That would obviously happen as we would prove the effectiveness of these strategies, and mainly also prove the nursing experience, and then prove that, hey, we can improve nursing experience and also improve and reduce costs as well. I think that's the disconnect a lot of times with we want to reduce costs, but we forget that, yes, patient satisfaction is important, but nursing and employee satisfaction is equally important. I wanted to read this. I think it was one of our required readings, but talks about the absence of joy and meaning experienced by a majority of healthcare workforces, in part due to the threats psychologically and physical harm that are common in the work environment, which is injuries and etc. And it just talks about, and this article was talking about the quadruple aim of, hey, the joy and satisfaction of the healthcare workers is equally important as the patient satisfaction. I had another, sorry, I have a lot of windows open here, but basically just another article, it talked about nursing retention. Let's see if I can find it. Yes, so it said, oh, I can't find it. Vacancy, basically talked about nursing retention and how, here we go, last year, so this is a 2018 report, so in 2017, turnover rate of bedside RNs rose from 2% to 16.8%. So anyways, just thought that was crazy. That is why I chose this subject to hope to practice this model on. Anyways, look forward to listening to y'all's videos. All right, bye.